Good day everyone, I am Marcel Kubik and today I'm going to perform a female catheterization. Urinary catheterization is introduction of catheter tube through the urethra into the bladder for the purpose of withdrawing urine. Catheterization is considered the most common cause of nosocomial infection. So, whenever possible, catheterization should be avoided. When it is deemed necessary, it should be performed carefully and strict aseptic techniques. Purposes: allows emptying of bladder, allows sterile urine specimens to be obtained, allows amount of residual urine bladder to be determined, allows continuous accurate monitoring of urinary output, provides avenue for bladder irrigation. So the equipments: urethral catheterization set, sterile gloves, specimen collection container, catheter, 2 drapes, graduated measurement receptacle, and antiseptic solution, cotton balls, forceps, lubricating jelly. Indulgent in catheterization set. It includes sterile gloves, specimen collection, container catheter, 2 drapes, antiseptic solution, cotton balls, forceps, lubricating jelly, drainage collection system, tubing and bag that connect to the catheter, and pre-filled saline syringe for balloon inflation, warm soapy water, washcloth, large towel, non-sterile gloves, sheet of draping, linen saver, tape, bedpan urinal or second collection container, goggles, optional for clients unable to maintain urinary control during procedure. Extra lightning. Assessment. Assess should focus on the following: type of collection of catheterizations ordered, straight or fully residual, status of bladder, distensions before catheter insertion, abnormalities of genitalia, client's allergy to iodine-based antiseptic or betadine. Midwifery diagnosis. Midwifery diagnosis may include the following: acute pain related to bladder distension, urinary retention related to neuromuscular dysfunction. Desired outcomes. Sample desired outcomes may include the following: clients attains and maintains urine output of at least 250 ml per shift during hospital day. Clients verbalizes relief of lower abdominal pain within 1 hour or catheter insertion. Special considerations: general of the catheter clots not pass through the urethra canal smoothly. Never forced it. Forcing the catheter may result in damage to the urethra and surrounding structures. Discontinue the procedure and notify the physicians if catheter does not pass smoothly and other suggested troubleshooting methods are done. Pediatric. In the baby girl, the urethra hooks around the symphysis in a C-shape. Common catheter size or catheter is size 8 and 10 French. Catheterization is a very threatening and anxiety-provoking experience for children, so they need explanation, support, and understanding. So, number 1, perform hand hygiene. Hand washing. Hand washing deters the spread of microorganisms. The procedure to the client to emphasizing the needs of maintained sterile field. The rationale of this is decreases anxiety. Excuse me, Mom. I have some catheterization for today for you, and I'm your caregiver for today. I'm Marcel. What about you, Mom? What is your name? Thank you so much, Mom. And clients, if he is or she is allergic to the iodine-based antiseptic, the rationale of this is avoid allergic reaction. So, excuse me, Mom. Are you okay with betadine? Okay, thank you so much, Mom. And number 4, provide a privacy. So every time we perform some perineal or a catheterization, we should have to close the doors or windows. This promotes the identifications of the anatomical facts, or decreases clients' privacy, decreases embarrassment to the patient. So number 5 is place light to enhance visualization. This promotes clients' identification of the anatomical parts. Excuse me, Mom, can I open this? Because I am going to perform a catheterization for you today. Then do the perineal washing. Perineal washing decreases microorganisms around urethral opening. The 7th procedure is position clients in a dorsal recumbent, then exposes labia. And then drape the clients so only perineum exposed. Provides privacy, reduces embarrassment. Next procedure, fields. Set up fields carefully, open catheter, set and remove it from plastic outer package. Place the catheter tip between client's knees and carefully open when outer. Remove skid without opening inner fold. Away. Next. Here's are all equipment inside of the package. And then, for antiseptic solutions over cotton balls. The rationale of this is prepares cotton balls for cleaning, avoids contaminating other items in kit. So put on gloves first before that. Putting gloves avoids contaminating other items in the kit. So starting from your non-dominant hand or your dominant hand, my dominant hand is on my right hand. Pick up the gloves, put on your lubricate 1 to 2 inches of a catheter tip and place carefully on tray so the tip is secured in tray. So carefully open this. It's prevent local irritation of meatus during catheter insertion. Promotes insertions. Remove fenestrated drape from lid and place on perineum such that only labia are exposed. On discard the drape if you prefer. Expand the sterile field. Number 13 promotes fenestrated drape from lip and place on perineum such that only labia are exposed, or discard the drape if you preferred. Rationale expands sterile field. So with the sterile force of indominant hand, cleanse meatus with cotton balls. Cleanse meatus without crossing, contaminating, or contaminating. D. Sterile field. Making one downward stroke with each cotton balls, begin to labium on side farther from you and move forward labium closer to you. Cleanses meatus without cross-contaminating or contaminating sterile field. Afterward, wipe once down center of meatus. Wipe with each cotton balls and discard.
separate labia minora and labia majora to your non-dominant hand and hold this position until catheter is inserted. Dominant hand is only hand sterile now. Contaminated hands. This is my dominant hand. A contaminated hand. Contaminated hand continues to separate labia. Exposes the rationale of this is exposes the urethral opening. So you should have to put 1 to 2 inch of a water-based lubricant jelly or KY jelly before you insert in the labia majora non-dominant hand and hold this position until catheter is inserted. After all, with the thumb and first finger, pick catheter about 1.5 to 2 inches from the tip. Gives midwife control of catheter tip, which easily bends. Carefully gather additional tubing in hand. Gives midwife good control of full catheter length. When things don't work out and you can't find the urethra, always remember that it is below the clitoris area. So you can use this stick before inserting the catheter on your patient's urethra. And then next is your catheter tube. Use the stick to know the pinpoint of the area. Then when you see a urine backflow, it says that you've perfectly inserted the catheter correctly. Yes, it's working. All right. And then, ask the client to bear down as if avoiding and take slow, deep breaths. Encourage her to continue to breathe deeply until catheter is inserted. Excuse me, ma'am. Can you please take a breath, inhale, exhale. So, after that, when we're putting a urinary or the drainage bag, we should have to put that on the thigh part, not under the thigh part, to avoid backflow of the urine that can cause infection to the client or inflation. You should put that drainage bag below the hips of the client or under the not movable area. Hook it like that way. In removing a catheter in a urethra, we should grasp catheter with thumb and first finger of non-dominant hand. Hold steady. Rationale of this is keeps catheter from being forced out by sphincter muscle, avoids contamination of distal portion of catheter. So all you're gonna need is 2 two cloth, sterile cloth, and a syringe to pull back the air of the balloon, so you can release the tube in the urethra. Pull back air for releasing the catheter. So you just have also to use your dominant hand and non-dominant hand to open the labia majora and minora and carefully remove the catheter. If indwelling catheter is separate from the bag and tubing, remove protective cap from end of tubing and attach drainage tubing to an end of catheter. Then secure catheter loosely with the tape to inner aspect of the tie on the sides, turned with drainage bag will be hanging preferably away from the door. Make certain that the tubing is not cut on railing locks or obstructed. Clean bed of all equipments. Reposition clients for comfort and replace linen from warm and privacy. Raise side rails. Measures amounts of urine in collective container. This provides assessments data. Then gathered all the additional equipment and discards gloves and perform hand hygiene. Hand hygiene deters the spread of microorganism. Evaluation. Examples of evaluation include desired outcome met, urine output 150 ml per shift, maintained during hospital stay, and desired outcome not met. Clients reports a lower abdominal pain 2 hours after catheter insertion. Documentation of this is the following should be noted on patient's chart. So you should have, as a midwife or nurse, record all the necessary assessment for the patients, as well as the genitalia if there is an abnormalities, and also note type of catheterization, the size and amount, color, consistency of urine returned upon catheterization, amount of urine returned before catheterization, if residual urine catheterization, difficulties encounter if any is passing on the catheter smoothly, reports for unusual discomfort during insertion, urine specimens of stains for culture. That's all about this perineal care. Thank you, and I am Marcel Amikubi of the Career College Foundation Incorporated. I'm done with the demonstration of my female catheterization. Thank you.